you don't really know who you are or what you are until you put a really big challenge in front of you.
Fear is an asset and ally here to help you be magnificent.
This crazy, silly, stupid idea to run across the Sahara Desert.
You did make it this time, but you said if you didn't make it, you would try again and again.
Everybody's connected to nature, connected to music, to their families, and now we're going to build a world that doesn't have racism and war and starving kids.
I kept telling myself, run at me, and just keep smiling.
All right, I'm recording. Looks like you got some Cubs memorabilia there behind you.
Yeah, I know. For someone who spent the last years on the East Coast in DC and Maryland, my roots are born and raised in Chicago, and I'm probably the only one that has an office in Maryland that still has season tickets to the Cubs. So go
That's
figure.
awesome. So, but you're in Arizona right now, right?
I am. My work, as you well know, I've got two main responsibilities right now. I'm the executive director of the MedStar Institute of Quality and Safety, which MedStar Health is a huge health system in the DC, Maryland area. And I also serve as CEO of the Patient Safety Movement Foundation, which is an organization based in Irvine, California. So I kind of split my time between the two, but we have a second home in Arizona. And when everything kind of shut down, the idea of working virtually, Arizona was a much better place to apartment in Columbia, Maryland right now.
Yeah.
And my wife's out here, and it allows me to do the walking that I've been doing over the last 3-4 months.
Yeah, I mean, so definitely want to talk about the walking that you've been doing, but real quick, just I like to paint a picture for the people who are hopefully walking or running along with us. I am walking in New York City. It's a little bit rainy right now. I'm in like the Gramercy area, walking towards my neighborhood, and we're still on lockdown here, so everybody's walking around with masks on, and I've got a mask on that I can pull up like this.
Mm-hmm.
Does that affect the audio, by the way, when I have my mask on?
I still hear you.
All right, that's good. And you're in Arizona in your home office there with some Cubs memorabilia behind you.
Yes, I am. Unlike New York and the East Coast right now, it is 109 degrees in Phoenix in the afternoon. So when I do my walks, I'm out the door by 5:30, 5:45 a.m. And
oh, wow.
I got 11 miles done by 9 o'clock and was back inside doing calls with my teams on both coasts.
That's great. So you get up, you're out there walking at 5:30 in the morning. What's it like in Arizona at 5:30 in the morning?
It's nice. The sun's just coming up, so it's like in the mid 70s, and so it's cooler. There's usually a little light breeze, but just like the mountains in Colorado and many other spots, as soon as that sun gets up in the sky a little bit, the temperature goes up by around 20 degrees. So literally by 10 o'clock, 11 o'clock, it's in the high 90s. Yeah, it's usually about in the low to mid 70s in the morning, a nice little breeze. So it's a nice time to walk, but
yeah,
8:30, 9 o'clock, the sun gets up in the sky and the temperature goes up by around 20 degrees. So by 9, 10 o'clock, it's right now around 95, 98 degrees. Like I said, today it's unseasonably warm for even Arizona, and it's up to 109.
Wow, 109. And it's not even like the summer yet. We're just in the beginning of May. Wow.
Yeah, it's about 10, 12 degrees warmer than it normally is, but it makes hydration very important, as you can imagine.
Yeah. So I guess you're definitely doing a lot of walking, and there's a story behind all that walking that you're doing, isn't there? Right? You were supposed to be, remind me again, you were going to be walking from Milwaukee Stadium, the Brewer Stadium, to Wrigley Field?
Yep, Miller Park in Milwaukee, and it was going to take in a Cubs-Brewers game on Friday, May 22nd, and then start my walk the morning of May 23rd from Miller Park, walk 100 miles pretty much along the lakefront between Milwaukee and Chicago, finishing at Wrigley Field 6.5 days later, where I was going to walk in and sit in my seats and take in the Cubs-Reds game. But all that kind of imploded with lack of travel and social distancing and staying close to home. So my new, keeping that baseball theme, is 125 miles starting Friday, May 22nd, 2 weeks from this Friday. I will walk the 125 miles in 10 days, starting at Sloan Park, the spring training home of the Chicago Cubs. And we'll hit all 9 other spring training facilities in Arizona, plus Chase Field, which is the home of the Arizona Diamondbacks, before finishing at Sloan Park on June 1st, covering 125 miles and taking pictures at all the empty spring training sites as I hit them through my walk.
I love that. That is such a cool. And so where are you going to be sleeping each night? Are you going to like come back to your home to sleep each night and then go and like start at each stadium?
Yeah, it's clearly with the idea of hotels. I had already the route planned from Milwaukee to Chicago and where I'd be staying each night. And now that is because of, again, the pandemic, my wife's going to serve as sag wagon, drive me to where I start each morning, and then I'll finish it. And she'll take me back home, and I'll sleep at home and be able to have meals and a change of clothes and everything.
Yeah.
I have to pack a backpack with supplies, say. And then the next day we'll drive to where I left off the day before and continue that trek for 10 days.
And so it's about, what, like 12, 13 miles a day?
Yeah, it averages just about a half a marathon, a little bit under that a day. My longest walk, I think, is 16 miles one day, and the shortest is about 10 and a half.
It's so creative. I love the way that you've adapted that to go, you had the original idea of what you were going to do, and like everything, everyone else, we've all been thrown through a loop. You got to adapt, and you still found a way to kind of keep the spirit of what you're doing, but and in a way even make it even cooler. Now you're going to hit 13 stadiums. Yeah,
and continuing that, and again, there's a lot of people that you'll want to go to every ballpark in the country as part of their bucket list. I'm going to spring training sites.
Yeah,
my bucket list. Maybe one day I'll grow up into the big leagues, be able to go to all the parks across the country. I've been to about 10 or 12 of them, and it's sort of following the theme too, which was 30 years. Yesterday was the release of Field of Dreams, one of the great. If you build it, he will come. And baseball has been the one thing that has survived through the years.
Yeah, that's right. I gotta go watch that movie. That's what James Earl Jones says, right?
Yeah.
Baseball, right?
Baseball's been the one constant through the years.
Baseball.
Yeah, he's amazing in that part. But there's so many threads to baseball, and look, I'm hoping that some of the speculation now is they may try to open up the season July 1st.
Yeah.
A second spring training the last couple of weeks in June, and if that's the case, there may be opportunities to do more walking later in the summer, fall, and literally do some walking and maybe do the Milwaukee to Chicago trek under social distancing and all the masks and things we need to do. But, there's a little Forrest Gump in me. Some of it started when back in January, I watched the movie Forrest Gump, and I was thinking, what could I do as a physician who's retired from clinical practice to support my friends and colleagues and heroes at the front line? And I felt sort of helpless that I couldn't find something to do. And I happened to watch Forrest Gump as a movie, and I said, maybe I just start walking across the United States. And I just doing it to raise awareness about patient safety and caregiver safety, all the issues that have reared up and received attention. Healthcare workers are such heroes. Yep. They're doing, you're living it every day in New York. I see my friends in DC and Maryland, and God love them, but it's shown some weaknesses in our system that need to be fixed so that we don't have the suffering and the loss of life we've seen in some of the caregivers and patients who I think we could have done a better job around if we were prepared. So that's the mission.
So let's talk about that, because that's obviously, you're doing the walking, but you're doing it for a cause. And you're the CEO of the patient safety movement?
Yeah, I took over that role from Joe Chiani, the founder, about 15 months ago.
Uh-huh.
I was board from the beginning. It's an organization that's an amazing organization. They are a global organization in over 50 countries, involved with over 4,600 hospitals across the world. And our mission is to achieve zero preventable deaths in healthcare. And even though we do some amazing things in healthcare, people are living longer, we're curing cancers we never thought cured, there's still a lot of weaknesses in the system that result in preventative harm and death, both for patients and caregivers. Fall rates and needle sticks and are higher in healthcare workers than they are in construction and any other industry. Suicide rates are higher in healthcare than any other industry, and that should never be. And so we try to bring those solutions and ways to provide care safer for both caregivers and safety movement mission.
So, you guys are one of our newest charity partners in the app, and I was really blown away, when I met your team and I actually learned about your mission and the work that you were doing. Preventable or accidental deaths in the healthcare system are the third leading cause of death. Is that right?
That is correct. Based on research and data, when you look at the causes of death, right behind heart disease and cancer are preventable events. Good people trying to do great work, but our systems and processes and looking at things through what's referred to as a human factor type of approach have been lacking in healthcare. And so many times I've been involved in medical mistakes that I made in my career that, again, no one comes to work to harm anybody. We come to work to heal people, but the systems fail us in that they don't provide the right mechanisms of support to do our work as perfect as we try to.
And what are some examples of that? Like if the system is failing?
Yeah, a couple real higher levels of preventable harm. One is hospital-acquired infections. For years we couldn't figure out why we weren't washing our hands 100% of the time. So we had data at 80 to 90% success. Now with COVID-19, everybody's washing their hands. Everybody has learned infection prevention, but hospital-acquired infections that really shouldn't have happened is one cause. The other big cause is misdiagnosis. You come in, have a test, and the results get read, but somehow don't get communicated to your physician. And find out 3 months later that your biopsy was positive for cancer, yet nobody saw it and acted on it. And now 3 months later, you have to start treatment and your cancer is advanced to a point where it may not be as easily treatable. We had things like that back when I was at the University of Illinois that completely changed the way we looked at safety in our institution and led to a lot of changes. But again, those are just examples of that happen all too often.
Is that because, is that because the doctor made a mistake in reading it? Is it because they had too much work to do and they were just going too fast and they didn't see it? Is it because, what is it in the system that causes that misdiagnosis?
Mostly just the craziness and the busyness of the system combined with communication breakdowns. We rely on one person to read that report in pathology and make sure that the primary care physician also saw the report. And if it happened to be put in the wrong part of an electronic record or patient document, it doesn't get seen until later on, when sometimes it could be too late. It is good people that just don't have the right systems and processes to work that. You look at other industries, a great example is aviation, and how they use checklists and how they use validate and verify tools and how they have a culture where anybody can stop the line when they feel something just doesn't feel right. That
Right.
culture isn't quite there in healthcare, and we need to get it there.
That's very interesting. You know, so many things that like I've been thinking about, and I might be off here and how I'm relating this, so you can let me know. But you know, with the coronavirus going on right now, for me anyway, it's really highlighted a failure of our system. And I don't mean a failure of our system that like happened in the last few months, but just a failure of our system all along, that we let ourselves get so unhealthy that we could be susceptible to a virus like this on a macro perspective, not on an individual perspective, or that our healthcare system could be overrun. It would ever be in a threat to be overrun by a virus, that we didn't have the ventilators or the systems or the PPE already in place, that it would ever be an issue.
Yeah.
To think that like we just weren't adequately prepared for it has really blown my mind, and is like the big lesson for this for me, that we should have been making these investments in our healthcare system a long time ago. And in a way, that's what you're saying, is like our healthcare system just needs a lot more systemic work, so that we don't have these like very simple things that, you know, could cause us so much harm.
Gene, you're so right in everything you just said. Many of us in healthcare knew that our systems were at maximum capacity. If you've ever gone into an emergency department, an inner city hospital on a weekend, you see people waiting hours and hours to be seen. Some of them could be very sick, and by the time we do have the capacitance to see them, their infection has maybe turned into sepsis, and now has moved to a state where it's a lot more difficult to treat it effectively. We have people that are waiting in hallways on gurneys to be admitted into rooms. And that capacitance has been a big issue. And we knew that if we were to see anything significant, not even to the extent that what we're seeing in the pandemic, but if we saw anything significant, you look at Hurricane Katrina down in New Orleans, you look at what happened in Missouri with the tornado that stressed those health systems. How do you make sure that you're prepared for those types of things and you act on them as best as possible? That's the overburden of many of our health systems across the country today. And we were set up in many ways to fail for the first couple months here, in your point. It's, as I use the example, we sent our nurses and doctors to war without ammunition, without the right protective gear. We sent them to war without diagnostic tests and kits, so that they could quickly evaluate who might have the virus and who didn't, and move the right people into quarantine. So we're catching up, but the first month or two were horrible.
So, you know, like so many things, these are changes that we should have been thinking about all along, but we weren't. So what are some of the changes that, you know, we can, you know, to take another trivial example, I see more people out walking and running than I ever did before.
Yeah.
Now, I don't know if you see it in Arizona, but like when I run on the East River in the mornings, there are more people out there than I ever saw before.
Prevention is so important, and to understand. I see the same thing you're seeing. Since this whole pandemic started out here in the Phoenix area, I've probably seen 5 to 10 times the amount of walkers and bikers and joggers out. And to their credit, everybody is following social distancing.
Yeah.
Walking down a path and somebody's walking towards me, either I will move into the street and walk along the curb and give them the path. And we all, you know, say hi and wave to each other, but everybody is honoring that social distancing, and they're out. And that's why I love what you do and your charity apps. It is so amazing, and we're so excited to be part of the program. In just, I think, a little over a week, we've got 140 people that are walking, and we're going to build that army up to 1,000 and more people who are walking in support. And we want to get over 1 billion steps of this army of people that say, we support the mission of a safer healthcare system, and we're walking to show that support. Because we are so excited about what you and Charity Miles have created. In just a little over a week, we have over 140 people that have joined our walking army, all walking or running for our mission of a better and safer healthcare system when we come through this. We have to identify and address those issues that the coronavirus has really unmasked. So to have that many people already signed up within a week, and our goal is to get well over 1,000, maybe 10,000 people, doctors, nurses, patients, and family members who've lost loved ones due to preventable medical harm. We're going to get them all, and we want them to continue walking with us until September 17th and even further after that. But our big target date is September 17th. That is the World Health Organization's International Patient Safety Day. And the Patient Safety Movement Foundation has aligned with the World Health Organization to do something in the US that recognizes that day and to bring the masses together and say, you know, we stand up for safety. We're walking. And if we could get over 1 billion steps that people have contributed to in support of this mission, I think that'll be awesome.
It will be awesome. And I'll also say, like, you know, one of the reasons that I'm so honored to have you guys on board is that so many of the other causes that we work with are you affect. You know, if you care about cancer, if you care about Alzheimer's, if you care about Parkinson's, if you care about diabetes, if you care about anything that has to do with health, you know, you care about patient safety. And, you know, you're touching and you're affecting so many of the charities that we work with in such a fundamental way. So, you know, we're grateful to have you on board. What are some of the changes that you would like to see our healthcare system put into effect most immediately?
Well, a couple things that we think would be very important. You know, when the Institute of Medicine report came out back in 1999 and 2000 that cited close to 100,000 people dying from preventable medical harm, there was a reaction by our congressional leadership. There were people who said, we can't have this happen. That's the equivalent of 1 to 2 airplanes crashing a day. If that was happening in aviation, we would shut it down and try to figure out what was going wrong. So we're looking to try to get some sort of group to come together and talk about legislation, not regulations, but what sort of legislation and support can be given to the healthcare system. Right now, most of the incentives are aligned financially. And that's understandable. I mean, no money, no mission. You have to balance your books. But there isn't enough alignment of incentives around quality, safe care. And so if we could create a conversation amongst both parties in Congress to what would that legislation look like that would help us move the alignment of these incentives forward, making care safer for patients and for caregivers. Because as you said, we are all patients. I don't care if you're working as a nurse in the ED at Mount Sinai right now in New York, patients, even though some are caregivers and some are from other industries. Ultimately, we all need good, high quality care. And
but what would some of those, like, what would be an example of what we could do to create better alignment there?
Well, I think, you know, more transparency around outcomes. Right now, hospitals don't like to share their outcomes and their safety records. They don't like to share the amount of nurses who are off on disability due to some sort of injury that occurred at work. You know, OSHA rates and DART rates and things like that other industries follow that track the amount of injury within your, within your system, within your hospital, within your industry as a whole. That data is really hard to find in healthcare. So I think we need more transparency, and through transparency comes learning. You know, we always like to say if we hide our mistakes and don't talk about them, they'll happen over and over and over again. And the idea of embracing transparency and being able to talk about them and learn. When you look at health systems across the country, and there's a number of them that are doing these things today, they've embraced what's called resilient science or high reliability. that really prioritizes safety and quality right at the top of the agenda. And those organizations are making great strides in reducing harm to both their care teams and to the patients they serve.
So does that transparency come through legislation, or does that transparency come through creating better norms? Is it something that like a certified organic system that you could do, like say that these are the organizations that are, give everybody a seal of approval if they're practicing those types of transparency?
It comes from, I think, a blend of all three things that you just said. One, it comes through legislation that look at other industries out there. Any sort of business has to have their financial records opened and available for audits. They have to post them every quarter, and then the Trade Commission is allowed to review them for being authentic and being valid. Look what happened with Enron. It took something like that to create legislation around transparency and openness of financial records. We need sort of something like that in healthcare. One of the ideas that many of us have been looking at and has been adapted in 2 countries across the world and in even a few states within the US is, should there be a national safety agency for healthcare, an area that people report their near misses, their unsafe conditions, their events where either a patient or a caregiver was harmed, into a database where experts in human factors and others could look at them and find system-wide solutions that then are shared through this agency across the country, so others could learn from them. But also there needs to be an impetus that they need to implement those changes that have been proven to be safer. So an agency is another idea that's been out there for about 10 years, yet hasn't moved forward, that we'd really like to see at least discussion on how the US can create a patient safety agency that is nationwide for learning and transparency.
Is there resistance to the idea, or is like, hey, we don't want to do it? Or is it just like, hey, we'd like to do it, but we don't have the money to do it?
Again, it's a combination of both. There are, certain stakeholders that don't see this being of benefit, and they want to continue to support the system as is or keep the system as is. It does take some finance. It does take some money to be put into, through the federal government, the creation of some of this work. But we're seeing how badly with this pandemic that if you're not prepared and you're not ready to go, it costs not only on human life, but the economy and everything. So the ability to be proactive and invest in some of this stuff earlier, that will hopefully prevent situations from this getting as bad as they become right now, makes total sense to many of us.
God, are there any other examples that you can think of that would be interesting for our members to be thinking about right now?
Well, I think the idea too of continuing to share best practices. If you look at, again, the airline industry, they will compete on on-time arrival. They will compete on lost baggage. They will compete on customer friendliness or service, but they never compete on safety. If they find something that's unsafe at United Airlines, within 24 hours, that is shared with every other airline through the FAA and the National Transportation Safety Board. That's the type of agency that I'm talking about that we need in healthcare. We should never compete on safety. We should learn about things and share. And many of us do, but we need that to expand. We need that to be a national priority, that we learn together and improve together. And we'll compete on all the other things that healthcare wants to compete on, but safety should never be something that we don't share and learn together.
Great. And what's something that our members can do to be supportive of your mission, even if they're, maybe walking for another charity or they care about another cause, but like they should all be caring about this cause. So what are some of the ways that our members can be supportive of your mission?
Well, I think it's important, as I mentioned, that we're all patients. So regardless of what you're using the health system for, be it just, basic care, that you're going in and getting your 1-year physical every year and health is good, or you're getting older and you need to start having, colonoscopy, or you need to have chest x-rays, or you have an illness. Many of the organizations you work with use the healthcare system, so often. I think the big thing is to ask questions. Don't trust the system to always work perfectly. If you're in a hospital and a nurse brings you a medication, ask what that medication is. It's 4 o'clock, it's my dose, it's correct, thank you. Have a patient, what we call a patient advocate or sentinel in the hospital with you when you're being treated or when you're going through some sort of, care in that hospital, and they can validate what you're hearing, as well as validate that you're getting the right x-ray scan. Look, we've had many times in medication issues where the wrong medication was sent up by pharmacy because the order was transcribed differently, or it was entered wrong in the computer system because somebody clicked the wrong button or the wrong link. And that medication gets all the way to the patient sometimes. We've got systems and processes that have been put in place to check and recheck, and nurses doing their medication checks. But at busy times and crazy times, sometimes those things get through. So the idea of really asking and being a partner in your care, you hear the term patient-centered care, but it really is, the patient being front and center in their care and being a partner with the nurse, asking questions, understanding why you're being sent down for a certain test that you didn't know had been ordered or your doctor said you were going to get. Those are the types of things where I think anybody that uses the health system needs to really ask questions and be a real partner with the care team in their care so it comes out as successful as possible.
Where can people go to learn more about this?
The Patient Safety Movement website is a great example to start. We've worked with so many patient and family advocates, those that have either been harmed or lost loved ones due to care, and they have really helped us shape what we call actionable patient safety solutions, apps. And we have roughly about 36 apps and sub-apps that are geared toward not only caregivers and hospitals that they could use evidence-based practice out there, how to reduce infections, how to reduce medication errors, but also the apps are friendly to patients and family members who have questions and want to learn more about their care. That's one great place to start. And there's others out there too. WebMD and other portals have really developed to help educate. And many hospitals have some great patient information areas on their websites that walk you through. If you're going in for a cardiac cath, per se, you can literally virtually see your day in the cath lab, from walking in the front doors to see the waiting area, to understanding the consent that you'll be asked to sign, to understand how the procedure is done. That is so reassuring and calming to patients and family members who show up for something and everything is just so new and scary to them. So those are things that are available to patients and families today through their hospitals and through organizations like the Patient Safety Movement Foundation.
And so that's patientsafety.org?
Patientsafetymovement.org.
Patientsafetymovement.org. Excellent. Well, really appreciate you. We've got a fire truck going by me right now.
Okay.
New York. But anyway, really do appreciate you sharing all of this with us. And we're honored to have you on board with Charity Miles and part of the Charity Miles family. It's such important work that you're doing that all of us really need to learn a lot more about and care about. So we're grateful for that opportunity to work with you. And like I said, I wish you well in your walk. That sounds like it's going to be a lot of fun. And I'll be walking some miles along with you in spirit. And hopefully some of our members will too. So David, thank you so much for sharing this with us. And thanks for everybody for walking with us.
Yeah, and thank you. We love Charity Miles. We are so excited to be a partner with you, and you're going to see some great things happen before the year's done, and some of the miles and steps and people that join our mission, and they'll join it thanks to Charity Miles. So great things.
we're grateful for the opportunity. Thanks, David. And thanks to everybody out there.
Stay well. Stay well, stay safe.
You too.